Well, it happened back in the mid-'80s or early '80s. You know, just a street brawl and got hit on the foot and never went to the doctor. By the time it started really spreading and opening up and might, you know, get infected, I decided to go and have it checked out. That's when I found out I have these ulcers, foot ulcers. I always thought ulcers was in your stomach. That was a shock. He said, you got ulcers in the foot? It was hard to believe or accept, but the pain made it all real. Like I say, this is a good deal. Here's some people that really want to try to make something happen for somebody that need it, you know, and it's obvious that I need it. So here I am, every day.
It's really a joy to work with these people who've been underserved and unprotected by society most of their lives, and see how they blossom.
The healthcare systems, as it's developed around the country and over time, has developed to be a transactional system. More heads in beds is the hospital motto. You know, how do you turn around as many people as possible in an emergency department? How many procedures can you do as a surgeon? How many imaging tests can you do? How many labs can you do? All that leads us to healthcare cost inflation. With coordinated care, with population management, which is really the DC3 and the complex care center is really an offspring of, is really addressing a large-scale population and finding those that need the care the most. And then also being flexible enough and adaptive enough that you're willing to do what's necessary to get the whole person, psychosocial and their healthcare needs all taken care of so that the greater society can benefit from it.
We basically coordinate the patient's care not only while they come here, which is usually 5 days a week if their wound is severe enough, but we also have to coordinate them for the weekend. And so it takes a lot of coordination on the office manager's part, the social worker, Michelle, the LVN, she does a lot of the coordinating as well.
We do a lot. We do try to treat everybody as an individual and figure out what it is that they need outside of what we think they need.
I'm going to work with them because they seem to know pretty much what they're doing. The doctors are doing certain things here at this clinic that has never been done at the hospital or anywhere else, you know, the little things.
There are those patients that are mentally ill, so we have a lot of dual diagnosis patients, both mentally ill and medically complicated, and then add homelessness to that, and we're dealing with a lot, but then we think they've been dealing with a lot, so really try to embrace them.
I need to be here, you know what I'm saying, to make sure that this is coming along well enough, whereas I can anticipate beyond this now. See, with the care that I get here now and the things that I'm trying to do in my life.
And you were only focusing on those, the top patients that really needs the care the most. You know, and we're not talking about simple diabetic with good family support. We're talking about those that has gotten so sick with no help that's probably going to be going in and out of the hospital because there's just no other support and there's just no other means out there to help them. And that's the one that we want to focus on. And so far we've been really successful.
So I'm trying to work with them, work with me. You can't beat a partnership like that.